Bismillahir Rahmanir Rahim. Assalamu alaikum. I am Professor Adam Ahmed Adam. This is part two of the lecture with the topic Candidiasis. As I mentioned earlier, Candidiasis is a mycosis caused by the yeast Candida albicans. And then we are going to continue describing the different clinical types of Candidiasis. Vulvovaginal candidiasis, also known as moniliasis. This is candidiasis of the vulva and the vagina. I have to mention here that this disease is not sexually transmitted because Candida albicans is already there in the vagina and the vulva. To be a pathogen, it needs only the predisposing factors. This disease is common among pregnant diabetic women. You see here, this is speculum view of the vagina. You see the red inflamed vagina, and also you can see the cervix and the cervical opening. And the most prominent feature here is the whitish creamy vaginal discharge characteristic of vaginal candidiasis. Onychomycosis, this is candidiasis of the nails. The nails will lose their smooth surface, and later in the disease they become discolored, brittle, and at the end they are sloughed away. You see here on your left hand side, the blue arrow is pointing to the swollen nail fold, and this is known as pyronychia. It is an acute infection due to Candida albicans. This lesion is painful. Onychomycosis is common among people with poor hygiene who used to expose their nails to repetitive trauma, excessive moisture, especially those who immerse their nails into water, and also chemicals as detergents and soaps. The disease is common among them. Mucocutaneous candidiasis. This is an extensive lesion of the mucous membranes and the skin. It is taking a chronic course, and it is due to congenital immunodeficiency, where the patient is born with immunodeficiency. Systemic candidiasis, candidemia, where Candida albicans is found circulating in the bloodstream and it may reach the cerebrospinal fluid. The disease is common among people who are moribundly ill, that to say severely ill, bedridden, catheterized, on parenteral feeding and treatment. Diagnosis, clinical, according to the clinical assessment. So you put a clinical diagnosis. Then the laboratory investigation to confirm the clinical diagnosis. You take the specimens from the moist area. You take areas. You take a swab. The swab, actually, it is a piece of small cotton wool rolled or wrapped at the end of a small thin wooden stick so as to take to sample the moist area. You are going to see the swab later, especially in bacteriology. Then in dry areas, you take skin scraping. In the nails, you take nail clipping or scraping. In the also you can take blood or CSF in case of candidemia. For the swab and scraping or clipping, you can see Candida albicans microscopically when you add potassium hydroxide to this specimen to dissolve the keratin out, and then by the light microscope you can see the yeast and the pseudo hyphae. Pseudo means false, hyphae false hyphae. The pseudo hyphae are formed by arrangement of yeast cells side by side forming chains. Also, you can dry the film, fix it, and stain it with gram stain. Gram stain is a very essential and important stain used in bacteriology. Uh, Candida albicans is gram positive. Then you can culture. Candida albicans can grow in some bacterial media, but the best medium for it is Sabrot's medium. The incubation is aerobic, that it needs in the air it needs oxygen. The best temperature 37 degrees for 24 to 48 hours. So then you are going to find the growth. The growth is white cream colonies emitting yeasty odor on agar plate. So if you smell it, you smell the yeasty smell. It is very characteristic. Now this is Candida. You'd like to know, is it Candida albicans, which is the potential pathogen, or the other type of species of Candida which are not potentially pathogenic? So you have to differentiate which is which. There are two tests used to differentiate Candida albicans from other species of Candida. These are GTT, germ tube test, and chlamydospore formation test. In GTT, you take the growth part of it and you incubate it in a serum at 37 degrees centigrade for 3 hours. If the growth is Candida albicans, it forms germ tube. Let's say an elongated tube from the yeast as the drawing above. Only Candida albicans is positive for this test. The chlamydospore formation, if you culture uh, growth of Candida albicans in a nutritionally deficient medium, that is to say a growth medium with low nutrients, Candida albicans forms large spherical spores. These are known as chlamydospores. This test is also positive just by Candida albicans and nothing more. These are examples of the other Candida species which are not pathogenic or are not potentially pathogenic. Treatment. The aim of treatment is to reduce the number of Candida albicans to its normal level, not to get rid of it. If you kill all Candida, you are going to create another problem, because by this you disturb the balance of the normal microbial flora. So in such candidiasis, usually there is overgrowth. You have to reduce the number to the normal, and that is the whole thing needed. Then to reverse the predisposing factors, the factors that facilitate the environment for Candida albicans to be a pathogen, you have to get rid of them. Then to reduce the number of Candida by topical antifungal drugs, such as clotrimazole, nystatin, miconazole, and others. In cases of onychomycosis and topical treatment failure, you can resort to oral, that is to say systemic antifungals like itraconazole, fluconazole, ketoconazole, and other systemic antifungal drugs. In case of candidemia, you can give a potent antifungal drug, which is amphotericin B. This drug is given intravenously. By this, the lecture is over, and I hope that it is understandable, and I wish you all the best.